Welcome to the Your Talent Matters podcast, where we delve into the world of human resources and employee benefits in Canada. Join hosts Mehdi Rahman, a strategic human resources consultant, and Nick Godfrey, a seasoned employee benefits advisor, as they explore the many challenges that businesses face in attracting, developing, and engaging top talent. So sit back, relax, and learn from the experts on how your talent matters when it comes to growing a business.
Hi, it's Nick Godfrey here, and good to see you all again on a new Your Talent Matters podcast. And today I'm really happy to have Dr. Raymond Rupert along with us today. I've just had a personal experience with Raymond Rupert's services as it relates to my son. And let me just tell you, without going into all the details, two thumbs way up. So again, I'm going to let Ray introduce himself, and I will just pass it along to him.
Great. Thanks, Nick. Hi, everyone. So my name is Raymond Rupert, and I was a family doctor for 40 years, so I paid my dues. About 30 years ago, I got an MBA at the Rotman School and thought I knew everything about business. So I started a business called RCM Health. And it's now been 25 years of running RCM Health. And our focus is on complexity. So all of our patients, we call patients clients, are individuals with very complex problems. And unless you manage a complex patient almost like a project, they can fall through the cracks. So at this stage, we have about 36 employees and about 3,200 experts, specialists, all over North America who work on teams with our clients. And our clients don't have to travel. They can be in Lethbridge or St. John's and get really good advice. And then we help them access government-funded care in Canada, wherever it's available. So that's my story at RCM Health.
So are you finding, because we hear this a lot, at least I do, it's funny, there's two sides to the story. It's like we hear there's problems with the healthcare system, but then if you ask an individual, what's your experience with the healthcare system, they often say, hey, it's pretty good. But the issue seems to be, and it was the experience in our family, waiting lists. Is that what you help expedite?
Well, there's no queue jumping in Canada, so hurry up and wait. But the waiting lists are a problem. If a patient's got spinal stenosis and they can't walk and they can't work, and they have to wait 1 to 2 years to get a decompression, which is not a big operation, then there's a problem. And so, and there was one study done that showed that 13,000 people died while on waiting lists.
That's a big number.
That's a big number. No one's really talking about that. So waiting lists are a problem. And we Canadians have to figure out how to address it.
And so do you feel you're filling a void here, or just adding a level of service that people can't do themselves? Because what seems to be needed out there, and we see it with aging patients and family members, is that it's good to have a healthcare advocate.
Yeah, I mean, when the individual is complex, like a lot of moving parts or multi-system involvement, and they're sitting inside a very complex healthcare system that's broken, the patient or the family can't advocate. They don't know enough to be able to advocate. And so we take the role of really representing the rights of the patient to care, timely care. And it's our job to do our best to get access to the right provider, doctor, at the right time. And we do our best, but there are clearly barriers to getting care. So it's a challenge.
Well, it seems that, there are a couple of different solutions, and I just want to make sure I understand where yours fits in. Certainly it worked for us,
Yeah.
but there are people who there's a good term for it. People who travel to get certain things done. I forget what they call it, but going to Mexico to get your teeth fixed, or
Yeah, yeah. So
and
that's called medical
that's really
tourism.
cosmetic more than anything. But
Yeah. So this is actually very interesting. So you're talking about medical tourism.
medical tourism,
Yeah.
yes.
So we work with a lot of companies, a lot of groups, and companies are taking more responsibility for helping their senior management to access care. So, for example, we have one CEO in southwestern Ontario that was found on a routine checkup, executive checkup, to have a small kidney cancer. And then he went to the local urologist in Ontario and he said, sure, we'll take out your whole kidney. Well, that isn't the best care, because this CEO could have what's called a partial nephrectomy. In other words, you just take the cancer off and you leave the kidney. And the best way to do this is a robotic assisted laparoscopic partial nephrectomy. Okay. So we checked the wait lists in Ontario, and it was probably 4 to 6 months to get in and get it done. So we have a relationship with Kaleida Health, which is a health system in Buffalo, which is 8 different hospitals. And he called us on a Wednesday and he saw the surgeon on Monday. And so we then got a price, and it's not unreasonable for this procedure, and he's going to be repaired. So I think the total time was about 2.5 weeks. We clarified the budget. We, in fact, have one nurse that just works on US placements for our patients. Okay, so medical tourism, unfortunately, is an option for some individuals.
Well, I know I've heard people who've skipped over to Buffalo just to get a quick MRI, and
yeah, the MRIs in Buffalo can be done within a day, and they're much cheaper than a corporately funded MRI in Toronto or wherever. And so, I think people are taking advantage of the fact that our neighbors have lots of capacity and lots of skilled clinicians. The other thing that's happening is that US health insurance or international health insurance is available for companies. In other
Canadian
words,
companies.
yes. So we have, say we have a senior management team of 5 senior managers. The corporation can buy US health insurance for the 5 senior managers, which would give them anywhere from $2 million to $5 million of benefit per year. And that covers just about every condition except for mental health. And RCM Health helps them find the best of the best anywhere, and then the insurance company pays the bill. And there's actually quite a bit of interest in having us provide what we'll call concierge care and bundling that with international medical insurance. The other way that can be done is by using CI, critical illness. In other words, if somebody's got, say, a couple $100,000 of CI, and it gets triggered for a covered condition, then we're very happy to find the best of the best. And then we've got a budget because the individual has received their payout. Another option.
That's a good one, because it clearly I like insurance where you pay a little, and if something happens, you get a lot. That's
Sure. Yeah,
that's
right.
the favorite. That's the favorite stuff.
Yeah.
And critical illness insurance is excellent. I recommend it a lot and build it into my employee benefit plans whenever possible. So it's very affordable.
Yeah. So we offer kind of this concierge care, VIP care for the C-suite. We get retained. We're available 365 for anybody on the team, and we respond with whatever they need. Got all kinds of resources. The other day we had one of our VIPs was in Croatia, and I just bought a penthouse there, loves it. on the sea and developed a large bowel obstruction. So I said to him, well, would you like to be hospitalized in Croatia? And he said, no. So I said, well, how far is Munich? Well, he said, that's a 5-hour drive. So I said, well, hang on. Well, what if we just rent a private jet for you? So I arranged for a private jet, which we can do anywhere in the world. And luckily, his large bowel obstruction resolved on its own. And so when he came back to Canada, we booked his colonoscopy funded by the province, and we'll figure out why he had his obstruction. Okay. So the C-suite, the senior executives that are pretty sophisticated, are really interested in a higher level of access and care. And we're very happy to be available 365.
So do you provide your services, like, are you with some of these organizations, are you on retainer with them, or, like you're there, or do they just call you when they need you?
No, we have a retainer type of relationship. So we have their health records and their imaging and all that, and we're prepared. So they're paying essentially an annual retainer per senior executive. And the preparedness is very key. For example, we had one CEO was golfing in Florida and had a stroke. So by the time the helicopter got him to the stroke unit, we were talking to the stroke unit at the hospital. And because he had his records and his history, they knew exactly how to treat him. And that can be really, really advantageous for the patient.
So as an employee benefits specialist and broker, I guess we should be talking to our clients who have, the C-suite and letting them know all about RCM.
Yeah, so the other thing, we just had a real estate development company. One of their development managers in charge of millions and millions of dollars of development got depressed. And if somebody like that leaves or goes on LTD, there's millions of dollars of projects at risk. And so the company hired us to help. And we have a fairly big mental health capability. So we had a private psychiatric assessment. We had private social workers, private OTs, and all the tools required to stabilize the individual as an outpatient. And all of that is done privately because the wait for psychiatry could be a year or two.
Yes.
Because the company is paying, we can accelerate and get that done almost immediately.
Well, and are you saying that, will you find, and I guess obviously if people are traveling, but do you often find these services outside of Canada?
Well, yeah, I mean, we obviously try to get the province to deliver because that's why the province is there. But if not, then the company has the option of buying an MRI or a CT or hiring one of our psychiatrists. And then if we can't get it, for example, we have another CEO with a very complex brain tumor. He's been to 5 neurosurgeons in Toronto, and they don't have the right equipment. So we have a relationship with the neurosurgical team at UPMC, which is the University of Pittsburgh Medical Center. And so he went there and, is seeing sort of the top skull-based neurosurgeon in the world. And then we got a quote. So, hopefully you're sitting when you hear what the quote was for the surgery. So the quote was US $255,000 for the surgery.
Yes.
Okay. Well, then it gets more interesting because the province of Ontario, as does all provinces, has what's called an out-of-country funding office. So our next job will be to put an application into the province to fund the surgery. And the surgery is not available in Canada. So
what's your success with that sort of thing?
Well, the province likes to say no,
Of course.
But on occasion they will say yes if things are not available. but there's, we have to put together the proper packaging, the evidence, and, all that. And on occasion, the province will write a check for things that are not available here.
Do you find sometimes that, because I've heard these stories in the States when there have been, out of country medical emergencies, that there's a team at the insurance companies negotiating with the hospitals because the hospital wants to charge this and the insurance company wants to pay this, and they'll kind of negotiate.
Yeah, so we've done a lot of what's called hospital bill discounting. So the US hospitals actually have 6 prices. And the top one is called Charge Master. And that is really goosed way up. Okay, so for example, we got a call from a family that was down in Florida, and father got into trouble and was hospitalized, and that was a US $300,000 bill. So our job, they hired RCM Health, and our job was to discount the bill. So we did a review of the bill, and then we started negotiating with the CFO at the hospital, and we're able to settle at $80,000.
Wow.
So that family very happy. They didn't have to sell the cottage, and good for everybody.
You earned your keep that time, Ray.
Yeah. So
wow.
Anyways, so this is a little bit of a peek into our world that no one knows about.
Yeah, it's been very illuminating to me. I tell you, the thing that jumped out that I didn't know was Canadian corporations buying American health insurance. So I'm going to be digging into that. Maybe, offline, you and I can talk more about that.
Yeah, there's a lot of things that companies can do to protect their senior management. One is we talked about is buying international medical insurance, but not travel insurance. This is different.
No, this is the real deal. Yeah.
Yeah, and there's also CI, the use of critical illness as a funding vehicle when combined with RCM Health. And then companies can buy services. They can buy, if the company's buying, they can get an MRI done in 2 days in Toronto or Vancouver or wherever. And not many companies understand that. So we're very happy to expedite, when we get a corporate client, a group broker, happy to collaborate and work with both.
That's a great bunch of information you've delivered today, Ray. I think that's a podcast.
Well, thank you very much for the opportunity to spread the word, and we're happy to help. Take care.
We're going to get this out into the employee benefit community as well. It's going on the Slack channel. The guys will see it there, and of course, it'll be on our YouTube channel, and we'll share it and get the good word out.
Thank you very much.
Thanks, Ray. Enjoy your weekend. Bye.
Bye.
Thanks for listening to the Your Talent Matters podcast. If you found value in today's episode, please share it with others. Be sure to subscribe wherever you heard this podcast so you never miss a future episode. For more information or to connect with your hosts, you can visit their website, yourtalentmatters.ca. Thanks again for tuning in, and we'll see you next time.